Standing Committee on Health has MP Hajdu in there, and she's not a happy camper. She gets grilled by MP Barlow and MP Davies, and of
In a
course, Michelle
heartbeat,
Gardner.
should we
Check it
need
out.
to
Sure.
support provinces and
I
territories
understand
in
your
their
position, Minister.
responsibility to deliver healthcare
Okay.
in their jurisdictions?
Okay, now,
Furthermore,
Minister,
I'll just
sorry,
say
Minister,
Danny
I have limited time, and I got your answer. Now, the Liberal-appointed Hoskins Advisory Committee on the Implementation of National Pharmacare recommended that federal, provincial, and territorial governments launch a national pharmacare no later than January 1, 2022, by offering universal public coverage for an initial list of essential medicines and then expanding to a comprehensive formulary. Will your government honor this recommendation and meet the deadline of January 1, 2022?
We are working as we speak on standing up the Canada Drug Agency, and that agency will be responsible for working on a formulary with provinces and territories, and that work is underway as we speak. As the minister, I'm focused on making sure that we're doing our utmost to protect Canadians against the importation of the virus and the variants, and the additional quarantine measures are
just a yes or no.
The additional quarantine measures are very important
So just a yes,
to understand whether or not travelers are arriving with COVID-19, and furthermore, whether or not the positive cases are variant. I'll turn to Ian Stewart for that answer.
You avoided answering the question. You gave me. You're just trying to run out the clock. I understand that, Minister. It's fine. I have a constituent in Southern Alberta who's a lawyer and filed an action against the government on the hotel quarantines, and his argument is during the Oaks test that the government must prove that it has jurisdiction or is warranting an infringement on Canadian rights on the Charter of Rights and Freedoms, Section 6. He got a response from Health Canada and your department saying you will not relinquish any data that would justify the reasons for the hotel quarantine. Why is it your decision not to release that data where they would show information on why the hotel quarantine is justified?
I'll turn to Ian Stewart to speak in general about the data we're collecting, but as this is a matter in front of the courts, it's not for me to speculate or discuss. Perhaps, Ian, you could speak about the data that we're tracking.
Yeah, for sure, I could speak about the data.
Just before you go to Mr. Stewart, the position was you are not going to release any information to help in the courts. So I haven't asked the question yet, Minister. If there is science and data that would warrant the reason for a hotel quarantine, that would say it is safer for a Canadian to quarantine a hotel as opposed to in their house, or this is a means to reduce the spread of the virus, why would you not want to share that information with Canadians to be transparent? Why are you refusing to share that information?
As the matter is in front of the courts, we don't respond.
Okay. Well, I think if you were, if this wasn't a political decision, you would have been happy to share that information.
No, as a matter of fact, I'll just negate that. We don't respond to matters in front of the court.
This was before it was in the court. We've asked this question before, and you've refused to answer it, Minister. So to me, this has nothing to do with a court
Thank
case.
you, Mr.
You avoided answering the question. You gave me. You're just trying to run out the clock. I understand that, Minister. It's fine.
We will now start our questioning in round one with Ms. Rempel-Garner. Please go ahead. 6 minutes.
Thank you, Chair. Long time no see from last night. Minister, how many members of the Canadian Armed Forces will be mobilized to help provinces administer vaccines in the next 2 months?
Thank you. Through the chair, Mr. Speaker, I'll turn to Ian Stewart at the Public Health Agency of Canada to talk about some of the planning underway to support provinces and territories if they need it.
Mr. Chair, a lot of work's underway for planning in that regard, and it's going to be needs-based in effect. It's difficult for me to speak, though, with respect to the plans of the Canadian Armed Forces in supporting provinces. What I can say is the Canadian Armed Forces is supporting us here, and as you know from Major General Fortin's presence, we do have a contingency supporting us here.
So would it be fair to characterize that there are no plans to mobilize any members of the armed forces to administer vaccines at this point?
No, I would not say it would be fair to characterize it as having no plans. I think perhaps it would be appropriate to have the Canadian Armed Forces talk about their support to this initiative.
I just want to know, I'm a minute and a half in, how many members of the armed forces will be deployed or mobilized in the next 2 months to help administer vaccines?
Well, Danny can speak to how many are currently deployed with the Public Health Agency, and then you're asking us to speculate on what will be required.
That's fine. I got what I needed. Minister, how many pharmacies will be administration sites for vaccines by the end of April across Canada?
Well, thank you, Mr. Chair. Through you, I'll say that the provinces and territories are, as you know, as the member knows, responsible for administering vaccines. We work closely with them to ensure that they have the capacity and the supports they need. I'll turn to Major General Danny Fortin to speak about some of the tabletop exercises with the provinces.
That's okay. That's fine. So, Minister, do you have any idea of how many pharmacies will become administration sites for vaccines by the end of April?
I think the member likely realizes that provinces and territories administer vaccines. Of course, we've been supporting the provinces and territories with their planning. I have an official that is actively involved in this planning and would be happy to share more details with you.
I'd be happy to have that plan tabled with committee. Minister, is there any money in the supplementary estimates here to support provinces in setting up administration sites at pharmacies? Or like you're basically saying it's not your wall, right?
Well, no, the member has a habit of putting words in people's mouths that is not accurate.
The minister has a habit of not answering questions. So I'll go on to the next thing. Are there any plans?
Ms. Rumpel-Garner, I would ask you to let the minister answer questions.
It is my time, and I know the Liberals don't like it when I own my time, but I'm going to keep doing that. Are there any plans to deploy?
When the chair wishes to intervene, it's the chair's time. So I'm not taking this away from your time, but please do let the minister and her officials answer the questions you ask them.
Thank you. Are there any plans, Minister, to deploy federally supported mobile vehicles and pop-up clinics to deliver vaccines?
As I've answered previously, Mr. Chair, there are plans to support provinces and territories should they need supplementary support to vaccinate their citizens.
Are there any plans right now? Like for federally supported mobile vehicles and pop-up clinics to deliver vaccines?
We have planning underway. It's comprehensive. If the member would like to hear about it, we have an official that's actively involved in those.
I have 2 minutes left, about 2.5 minutes.
So the member doesn't wish to hear then the details.
They can table that. They can table that with committee. I was just asking if you had any plans to do that, but I think I've got my answer on that question. Does the federal government have any plans to set up websites, et cetera, to help people get appointments for vaccines?
Again, the member perhaps doesn't realize that it is in fact provinces and territories that have the right and the responsibility to administer health care, including vaccination.
Okay, so there's no plans from the federal government to assist in that. What percentage of people over the age of 65 have received a dose of a vaccine to date?
Perhaps I can turn to my officials for the percentage of people that have received doses. We may have some of that information. Ian, would you like to speak about the province's progress?
I've got a minute and a half left. You don't have that off the top of your head, hey, Minister?
Let me be clear. We have a ream of data on vaccination, on the planning of provinces and territories.
You came
and
here
I'm
to
more than happy.
I'm
more than happy to provide that information through the appropriate officials and agencies. And so, if you would allow them to have a moment to answer,
You're the minister, and I asked you, and you don't have it. So, with the time I have left, I'd be happy if somebody would table that with committee. You can't answer that question at your fingertips, and it's kind of a big question. My last question, Minister. Do you agree with this statement? Even if we sustain lockdown indefinitely, which would cost lives and do immeasurable harm to our children, we would not be able to eradicate this disease, referring to COVID-19.
I'll turn to Dr. Tam to talk about the most recent research.
Yes, Mr. Chair, the coronavirus is found in every country and territory around the world. So it's unlikely to disappear from the global population for some time. And science is evolving, but that is
Minister, would you care to answer if you would agree with that statement or not?
I trust the expertise. I have a top-notch virologist as the chief public health officer, and I trust her perspective. She is far more eminent in this area than I am.
Thank you, Chair.
Thank you, Ms. Rempel-Garner. We will go now to...
Don't forget to like, dislike, subscribe, and comment. Safe Space Cafe. And always,